Hello, everyone. Thank you so much for joining us today for this presentation. We'll be getting started in just a minute. As folks get logged on, I do have just some housekeeping announcements. On behalf of the California Labor Lab and NIOSH Center of Excellence for Total Worker Health, it is our pleasure to welcome you to today's session. You are going to be muted during this presentation, so if you'd like to ask a question, please enter it into the online Q&A, and we'll save time at the end of the presentation to address as many questions as possible. This presentation is being recorded and will be made available on the California Labor Lab and Center for Occupational and Environmental Health YouTube page in the next 5 business days. And all participants who logged in with their registration email for the full live presentation today will receive an email with a link to the evaluation form that will qualify you for a certificate of completion with 1 continuing education contact hour. Once the evaluation is completed, you'll be able to access and print your certificate. Just a note that Total Worker Health is a registered trademark of the U.S. Department of Health and Human Services. And our project is funded by NIOSH as a part of the Total Worker Health program. And also an invitation to join us in April 29th to 30th. We're going to be having our annual symposium. This is a virtual event, so you can join us online. It is also free to attend, so we definitely encourage you to sign up and join us. We're going to be from 9 a.m. to 3 p.m. Pacific, and our theme this year is Art and Labor in a Gig Economy. So we hope to see you also in April for that symposium. And without further ado, I'm going to hand it over to Dr. Christina Banks to introduce today's speaker.
Thanks so much, Michelle, and I couldn't be happier to introduce our speaker today, Meghan Davis. Meghan Davis is an associate professor and doctoral program director in environmental health and engineering at Johns Hopkins Bloomberg School of Public Health. She directs the Johns Hopkins POE or PO Total Worker Health Center in mental health, which takes a holistic approach to the health and well-being of workers, particularly frontline workers in agriculture, healthcare, and service sectors. She received her DVM from the University of California Davis School of Veterinary Medicine in 2000, and her MPH and PhD from the Bloomberg School of Public Health in 2008 and 2012. Prior to her faculty career, she has over a decade of experience in veterinary medicine, including dairy practice. This is important for today. She recently served on the NASEM Planning Committee for a workshop on potential research priorities to inform readiness and response to highly pathogenic avian influenza A, H5N1. That's why she's here today. Her research is grounded in One Health efforts that promote transdisciplinary systems thinking efforts towards improved human health, animal health, and environmental health. So you can imagine her topic today is H5N1 Avian Influenza, considerations for a total worker health approach to response. Meghan, it's a delight to introduce you and to have you join us today for this webinar. So you have the floor.
Thanks for having me. It's great to be here. I'm excited to talk about the thing that I've been talking about for most of the year, which is H5N1 avian influenza. But what's really exciting about what I'm doing today is bringing in kind of that marriage of holistic approaches with total worker health and One Health, both at the forefront. So I just want to start with a land acknowledgement that no matter where you are probably on the traditional and contemporary homelands of Indigenous peoples. And so I just want to make that acknowledgement. What I'm going to do with this is really start with the grounding in total worker health that many of you may be familiar with. You are at a total worker health seminar after all, but then give you the introduction to what One Health is and how both of these approaches really rely on systems thinking and partner group engagement and integration of methodologies. And then we'll apply these to the H5N1 avian influenza outbreak. And so I'll give a bit of a history. It's been a major problem in California and the West Coast in particular, but has impacted many other states. There are a lot of occupational exposures involved. And then we'll start talking about some opportunities, especially from a total worker health perspective. I'll pause for a second just to acknowledge some of the activities I've done with the National Academies for Sciences, Engineering, and Medicine, both on the proceedings document out of our research priorities workshop that I was on the planning committee to help develop, and then another one where I was the chair of the US committee to really think about guidance for countering spillover in Southeast Asia. But we have applied a lot of those approaches to our thinking about this particular outbreak in the United States. So what do I mean when I say systems thinking? If we were in a classroom, I'd have you all raise your hands and tell me what you think. So take a second. What does systems thinking mean to you? In science, we use very appropriately reductionist approaches. These are more simple. They focus on a single connection or a single element, usually in trying to kind of take care of all the rest of the things that could influence it as nuisances in the way we're trying to understand the role of that one particular thing. But in systems thinking, we're really focused on the complexity, on the multiple connections, and on the feedback loops that can change things over time, creating dynamic situations. And there's nothing more dynamic these days than H5N1. Literally, what I would say tomorrow might be different than what I say today. With total worker health, we really think about systems thinking in terms of different elements that need to be engaged and how they can work together to promote the health and well-being of our workforce. We do things like preventing harm. I call it putting on my Wonder Woman gauntlets, protecting workers from things that can hurt them. We also think about health promotion. How do we deliver opportunities for well-being? And then how do we manage illness and make it possible for workers who may be struggling with conditions to be able to participate in the workforce? And all of these really rely on an understanding of the social determinants of health at work, right? The socioeconomic and political context that can be drivers economically in terms of the job market, that's quite active these days, and labor policies. We think about our socioeconomic status, education, occupation, income, job satisfaction. We just had a seminar today with our workforce mental health program thinking about job insecurity. And so these are things that are really impactful on a lot of the decisions that we make. And then, of course, our living and working conditions, access to healthcare and mental health resources, and how all of these work together to influence worker health. One Health is also holistic, although it takes a slightly different tactic. With One Health, we're thinking about that Venn diagram. And so here you see human health, animal health, and environmental health, which might be broken down into the built environment, so our engineered systems, and plant health or ecosystem health is another component of environmental health. And where all of these overlap is what we call One Health. And so a lot of these approaches really are very participatory, meaning that they engage with communities. They have a lot of valuation of Indigenous knowledge. And the science and programmatic activities really are transdisciplinary, where those experts from each of these dimensions all come and work together to design, implement, and evaluate a program or research. With partner group engagement, I think it's one of the most important, and here's a shout out to one of my PhD students, Dr. Eri Togami, who is mid-career. She's actually been engaged in One Health as a veterinarian for quite some time and is working on her PhD. So she's been doing some thought leadership in the area of partner group engagement, really thinking about what it means to do co-design with communities, and this can include worker populations, and how bidirectional communication is absolutely essential to this. And this will come up in the H5 example. In the case of emerging infectious diseases like H5N1 Avian Influenza, what you might hear as bird flu, we really think about different agencies from a One Health perspective. So we might think about the World Health Organization, the Food and Agriculture Organization, the World Organization for Animal Health, which was formerly OIE, it's now WOA. Yeah, not the best acronym, but here we are. And the United Nations Environment Program. Collectively, these international agencies are known as the quadripartite, and they form the governance structure for One Health activities globally. Then you have the interface between the quadripartite and your various national agencies or ministries. So in the United States, that would be the CDC, the United States Department of Agriculture, the Food and Drug Administration, the EPA, et cetera, that might be engaged in the response. Then, of course, you have your subnational, in this case, our state agencies or departments. So your California Department of Health, your CDFA, et cetera. And you have the community and public, but as a veterinarian, I'll say that there's a really important interface between the state and the community, or between any other agency and the community, and that is through our frontline workers, whether those are community health workers, animal health workers like veterinarians or other animal care workers, and other partners who may be engaged, like advocacy groups. And then I stand, in the ivory tower in academia going, hey, but there's scientific evidence. We can have guidelines and best practices. And this can all help with that collective assessment of risk, communication of risk, and mitigation of risk. So let's move on with that grounding into the case for today. Highly pathogenic avian influenza is called high path by veterinarians, and that's in contrast to low path avian influenza. So some of the strains exert more damage than others, and those are the high path avian influenzas. Just like any influenza virus, we characterize these into types, clades, and subclades, and the types are usually based on the hemagglutinin, which is that H, and the neuraminidase, which is the N. The reservoir hosts are waterfowl, although we are starting to recognize that there may be some additional involvement of other birds, like birds that are gulls and whatnot, that might be more on the ocean side of things as opposed to the ones that land in ponds and rivers and reservoirs, like ducks and geese, and those are the typical reservoir. What we typically consider to be the target from an animal health perspective are poultry, domestic poultry that we're raising for food. This can be broiler chickens for meat, layer chickens for eggs, and turkeys. And we've long recognized that people can get avian influenza, but it's typically sporadic and typically occupational, or someone who keeps like a backyard flock. There are many species potentially susceptible. So this is an older image that shows those waterfowl, and also showing the additional species that can be involved. Cats are known to be particularly susceptible, and we really worry a lot about pigs. Pigs have their own swine influenza viruses, and you might recall the 2009 swine influenza pandemic that was caused by an H5N1. The biggest concern is when we get avian influenzas and swine influenzas together, or when we get avian influenzas and human influenzas together. And the reason for that is these viruses can not only mutate, meaning they change over time just by little shifts in small dimensions that can be amplified if they get into kind of the right conditions and right hosts at the right time, but also that you can have these larger, what we call reassortment events. So this is like swapping trading cards, if you have a host infected with both an avian influenza and, for example, a human seasonal influenza virus, then they may swap much larger pieces of genetic information, and that could result in one of the zoonotic strains, the ones coming out of birds or pigs, suddenly being able to establish human-to-human transmission. So I'll just give you the reassurance. I've got an alert, not alarm. We have not yet documented human-to-human transmission. There's a little suspicion, but nothing documented yet. So we haven't quite crossed that step on the path to pandemic. we think about the global epizootic is a fancy word for pandemic for animals. Since about 2020, H5N1 has really dominated. This is particularly clade 2344b, and it's impacted tens of millions, maybe even billions of birds, mostly wild bird populations and domestic poultry. But the staying power of H5N1 has been really unprecedented. There was another avian influenza outbreak that lasted only 2 seasons. It was, I think, 2014 to 2015, and that was considered a pretty big one. So to have this continuing in North America since 2022, actually late 2021, and globally since about 2020 is really remarkable. So this is a unique virus already. It's really gotten into a lot of mammal species. It's had mammal to mammal spread, including among farmed mink. So mustelids like ferrets and mink are highly susceptible. We use ferrets as our laboratory animal model for influenzas, but it's gotten into marine mammals. So there was a big outbreak in South America, just I guess a year and a half ago, involving sea lions and other marine mammals. And many other mammals have been affected. It's actually hit domestic foxes pretty hard in North America. We've also had one pig affected. I'm not sure if there's consensus on true infection or not. It was a pig on a premises that had multiple species with H5N1, mostly birds. But really what we've been seeing that's been of high concern and high relevance to California as the #1 dairy state in the country is this incredible spillover into dairy cows. To say this is a plot twist is an understatement. Normally in dairy cows, and I was a dairy practitioner, I saw a cow that was coughing and I thought about the ventilation in the barn. I did not think about influenza. I mean, they can get influenza Ds. I think there's been a case report or two for influenza A, but to find avian influenza in a dairy cow was really unprecedented. This was just a major shift in the epidemiology. And the bizarre thing from sort of a virology perspective is that this virus is just laser focused on the udder. It's unusual. So we think about cats as having respiratory neurologic disease. We think about people as having mostly respiratory disease and sometimes additional like gastrointestinal or sometimes neurologic involvement. But the cows, it's really been mastitis, and they've had some other organ systems affected like the gastrointestinal tract, but the milk is where you see the most virus coming from these cows. And so this has really been an interesting detective story. And so this is just a brief timeline on some of the identification initially in the Texas Panhandle, the movement through movement of a cow, because cows move around all the time. Dairy is really quite the revolving door from one farm to the next. And so there was movement into Michigan. There were goats affected. There were other poultry and wild birds affected. And of course, then we had the first dairy associated case last April. To date, we have, and these data are as of yesterday, but they are not, I think, completely updated because we've actually had some very recent detections in the mid-Atlantic, in Pennsylvania, in Delaware, and others. But you can see that California is pretty hard hit. The surveillance in wild birds is a lot more sporadic, so we can't completely trust it. And this definitely does not show the recent cases in Maryland, actually not far from where I am right now, where we had a lot of birds affected. The mammal map is interesting for 2 reasons. First, it shows just the remarkable diversity of mammal species that have been impacted. And again, this is just showing how adaptable this virus is, which is one of the things that concerns us in terms of pandemic potential, because it could mean that the virus can get into a lot of different species, and therefore there may be roles, for example, for wild mice or rodents to be part of some of the disease ecology. This is an area that we have a lot of interest to learn more about because we don't have a lot of information about it. The other thing that this shows is how many domestic cats. It's been over 100 domestic cats impacted, many of them fatal, and many of them through a food consumption route, like raw milk or raw meat pet foods. So you can see that when there are companies that originate, for example, in California, that are distributing product nationally, that you can get cases all over the United States. But here's the dairy cow story. Oh, I forgot to update. It's actually 17 US states that have been affected. It's been almost 1 million herds, and California represents over 75% of the outbreak. Most of the California outbreak has been driven by the original genotype, B313. So this is a different variant. So this is within that type and that clade. So you go down and, so this is like kissing cousins, right? Once you get down to the variant level. It's caused some symptoms in cows, but not the devastation that it causes in poultry. So in poultry, it tends to cause really severe disease and high mortality. In the cows, we've had some mortality, especially in California, which I think was because a lot of the initial outbreak occurred during a heat wave, and it was, dry season. So the cows got really dehydrated. But they can be the things that you see anytime you walk onto a dairy farm. So if I walk onto a dairy farm, the producer says, "Hey, doc, I got a cow. She just ain't doing right." We call that ADR in veterinary speak. Yes, technical term. And it just means, not eating so good, not milking so good, just not right. So a lot of the cows can fall into that category. So you can see how easy it is to miss it and how hard it is for a worker to identify if a cow may be infected. It also causes sometimes very severe mastitis. In fact, the milk itself can look really sort of chunky, cheesy, or bloody. What we've noticed is that there's a lot of cow-to-cow transmission on farms following the introduction, and so you can get variable percents of the herd affected. The reason there are some additional concerns with dairy farms and H5N1 is because a lot of times we're raising them in conditions that are freestall conditions where it's very easy for wildlife to gain entry. So you can see the dairy cow on the left, that's an image from New York. I've got one from Maryland in the middle, and I think the one on the right might be one of my Midwestern ones, but the farms that you see in Tulare are a little bit more like the ones on the right. They'll have roofs and really no sides, and the cows will go into these free stalls to lay down. This, by the way, is a wonderful thing when it comes to cow comfort, cow productivity. The cowness of the cow can really come out with the freestall model. So this is part of where that sort of California cows are happy cows came from. It's really a lot of attention to this, but it doesn't keep the wild birds out. It doesn't keep the wild rodents out. It does not keep the cats out. We know that cow movement from one farm to the next is part of the transmission, but we also know that shared equipment and shared workers, maybe even visitors, and geographic proximity, including the potential we're now starting to realize for plume effects, where if two farms are located pretty close together, it may be possible for airborne transmission to occur for the virus. Those data are coming mostly out of Europe, so we haven't yet documented that in the United States, but we suspect it may be happening. And we know that there are all of these other animals that can be on farms. So some of the biggest production facilities are really going to be just one animal species. So just dairy cows, although there may be cats, cats will just show up on the farm. It's not like the farmer's adopting cats. They just show up and say, "Hey, this looks like a buffet to me. You've got wild birds, you've got rodents, and there's milk. This is perfect. I'm going to set up shop." But the mice, as I said before, are a big concern because they've been demonstrated to be positive near farms that were affected, and also in laboratory studies to become infected and shed the virus. So they may be playing a role that we haven't yet fully identified. Let's talk workers. So in terms of the case summary for humans with H5N1, just limited to the US, with a little nod to Canada, dairy workers really represent over half of the 70 cases. And we've had a lot of poultry workers affected as well. Many of the poultry workers are working on stamping out operations. So what we've, at least what we've done traditionally up until this point, hopefully we'll continue to do, is because the animals get so sick with poultry, is that we go ahead and do a depopulation of the farm. And so you need to bring in workers to help with that process. And so those are often the workers that we've seen get infected. But dairy, it's included people who didn't even know that they were working on a positive farm, or the farm didn't even know that it itself was positive. The more recent case in Nevada may be that situation, because that was identified before we even saw disease in the cows. The National Milk Testing Strategy, which is a surveillance tool that looks at the bulk milk that comes into the dairy processing plant as a point of sort of window of opportunity to see what's going on, identified the positive before the cows on the farm showed up, and we identified the worker. There have been a couple of cases, about 3, that we just don't know where they got it. And then there have been some others, especially the Louisiana case that was fatal, where we did recognize that the person had contact with wild birds and backyard poultry. There also was a Canadian teen who was hospitalized and who did not have any known poultry contact or contact with poultry in the area that were affected. And recently, the Ohio poultry worker who also had a D1 strain. So this is different from the B313 strain. And you can see that all of these severe cases were either D11 or D13. So how do dairy workers get exposed? Well, if you work on in a freestall facility and you have a milking parlor, the cows will come into the parlor and the udder is at face height. And you are putting on the claws, you're prepping the udder, putting on the claws, taking the claws off. There's milk flying everywhere, right? And it's all at face height. So the workers really are presenting with a lot of conjunctivitis. And this is, mild for avian flu, but on the conjunctivitis scale, pretty severe conjunctivitis sometimes. Just Google the New England Journal case report of the first worker if you want to see an image of how severe the conjunctivitis is. I'm sparing you that photo today. But they've also occasionally had some respiratory symptoms. And now that we have the poultry worker who's been hospitalized, that's really the first very severe case in a worker. And the poultry workers are exposed a little bit differently. We know it's shed in the milk for dairy cows. In the poultry, it's often shed in the feces, so it's the litter. And the birds will flap and kick those particulate up into the air that have the adherent virus, and that's a way that you get exposed kind of through a respiratory route. And there was some thinking in a cluster of cases in Colorado last summer where there had been a heat wave at the time, and they really, it was like 104 Fahrenheit outside of the poultry facilities, and they had to bring in giant industrial fans just to make it possible to work at all for any length of time in that setting. And there was some thought that even though many of the workers, although not all, but many of the workers were wearing masks N95, that it could have disrupted the seal of the mask. And we certainly recognize that a lot of our workers in agriculture are either part of, migrant or immigrant communities. They may not even speak Spanish. They may speak indigenous language, and they have a real distrust of authorities. And I think it's beyond fear of deportation. They also lack access to healthcare. And so they may not be part of a lot of the surveillance programs that are in place in the United States that are how we identified some of those cases that didn't have contact with animals, is through these particular surveillance networks. We also know through some of our own work that they don't always accept kind of a blood draw. It's a little invasive. So some of the work that some of my colleagues and I have been doing has really focused on salivary antibody testing. The other thing to recognize is that putting on an N95 and a face shield and Tyvek fluid-resistant coveralls and putting something, a head, face, hair covering in the heat of summer, working in these very sometimes moist environments with lots of organic material is it's quite difficult. The PPE is not really designed to stand up to these settings. And so I think that also can drive decision making about use of personal protective equipment in our workers. So if we think about the surveillance, this kind of goes back to what I mentioned at the beginning, where I've been working with the national academies on, well, how do you use surveillance tools to identify, either hopefully prevent, but also really focus on that early detection and response when you have a zoonotic emerging infection. And so with this, we think about our passive and active surveillance systems, the ones that just sort of operate all the time, and then the ones that you harness and really go out and kind of push out in order to get activities done. Those are the active surveillance ones. How you assess risk and then feed that back into decision-making, a feedback loop for a system, and how that decision-making can also then enhance some of your surveillance. But how in all of this really focusing on being participatory and engaging with communities and with workers is absolutely essential. And that all of this working well together can help drive more effective interventions. So if I break this down for H5N1, we have influenza surveillance, we have mandatory reporting by our United States Department of Agriculture accredited large animal veterinarians, of which I used to be one. We might look at bird movement. For example, the USGS did a pilot study before H5N1 that identified that migratory waterfowl tend to hang out on dairy farms in California. Who would have thought? You also have the risk assessment that's being done by the federal authorities like the CDC that can feed back into, hey, public risk low, risk for occupational exposure much higher, maybe risk for consumers a bit higher. And then really feeding that into decision making. So helping to increase indemnification programs for poultry and dairy production, really driving some of the surveys that have been done, sero surveys in veterinarians and workers by the CDC, identifying the potential for asymptomatic cases. And then what that means in terms of traceback and how you might feed that into interventions. So for example, the CDC made a decision quite a few months ago to switch from just testing symptomatic workers and just recommending ostamivir, which is an antiviral countermeasure in the symptomatic workers, but instead offering it to everyone because of the detection of the asymptomatic infections. We've also seen a role for both wastewater surveillance and bulk milk surveillance in terms of early detection before you see the cases, even in animals. We go into these authorities and the surveillance systems, and we think about our workforce, right? We know that the California outbreak began despite a mandatory testing program before any cows moved from one state to the next, really leaning in on that federal authority to regulate interstate transport. So we had the introduction to California despite that. I've heard the rumors of what we think happened, but I have not seen yet confirmation. If anyone's heard confirmation, I'd be delighted to hear about that in the Q&A. But we also know that our migrant and immigrant workers aren't necessarily part of the influenza surveillance system. We also know that for wastewater surveillance, that our dairy wastes are typically managed at the farm level, maybe sprayed onto fields. So there could be environmental transport that we need to further identify. We also know that a lot of our rural communities are on septic systems that may feed into wastewater very late, like years later, or may not at all feed into these municipal wastewater systems. We have major gaps in companion animal surveillance. I've written about this. You can ask me in the Q&A because I'm focusing on our workers here. But then we also have these inconsistencies in data sharing that make it hard to feed these into more predictive models that could help us get ahead of this virus. We focus on the interventions, from an occupational health perspective, we like to center these in the NIOSH hierarchy of controls. This doesn't mean that PPE is not effective. It's just on the kind of scale of more to less effective. It really relies on the individual workers and the conditions and the challenges I've already mentioned about use of PPE. We might have administrative controls, engineering controls. Of course, the best would be to eliminate the virus, but that's a little difficult to do with a zoonotic virus. We could think about vaccination strategies for animals, and there is a vaccine for poultry, one developed specifically for H5N1. There are some barriers to rolling it out, I'll get into in just a moment. If we come down to engineering controls, I think about, well, could we redesign the dairy parlor? And I know that some of our, agricultural centers funded by NIOSH have also been thinking about these things. How do we improve biosecurity and biocontainment? How do we keep it from getting onto the farm, including through wild rodents and wild birds? And how, if it's on the farm, do we prevent it from escaping? Do we need to reimagine our workflow? Are there ways that we can segregate high-risk activities to help prevent spread? And we've been working on improving access to PPE. For example, both the national and state stockpiles of personal protective equipment were opened up for this outbreak, and there was deployment, especially face shields, into some production facilities that requested it. So of course, still relies on some voluntary activities, and I think that can be an area of opportunity. The barriers to animal vaccination are more than you think. It's not just sort of the technical aspect of development. That's actually relatively easy, but it's more the technical aspects of testing. How you differentiate infected from vaccinated animals has important implications for our trade agreements. And some of our trade agreements also require disease-free status, which helps drive the stamping out policies for the poultry. So it's really complicated. There are a lot of kind of economic issues as well as issues on the political side that relate to our relationships between the United States and other countries in terms of the trade agreements. But what about total worker health? So this is the part that I've enjoyed thinking about the most. If we think about the total worker health hierarchy of controls, we now substitute, right? Our elimination is now eliminate negative working conditions, eliminate barriers to safety or well-being. We're substituting our workplace policies for those that improve safety, health, and well-being. We want workplace design for healthier, more productive working conditions. So these are usually win-win, right? Looking for both higher productivity at the enterprise level, as well as improved well-being for the worker. We think about education and really providing resources for knowledge dissemination and improving knowledge and also in terms of access to additional benefits or additional care. And then encouragement for adoption of healthier practices. So on the elimination side, we can think about facility cultures of work, which I think are modifiable, right? If you have good leadership on a production facility, if there's valuation of the workers, then you can change that culture of work in order to help support the workers through these very stressful periods. I think at the state level, there can be opportunities too. I'm not sure this is the moment to address the federal culture of work, but the USDA really has tried to do a lot of deployment of rapid response teams to the states that are impacted. And so maybe thinking about how to better support that group could be something that we might be able to operate on in the current climate. For design, if we need to re-engineer a dairy parlor so that the new dairies being built would look a little different than the dairies that are already established. If we think about our biosecurity and biocontainment, why not also think about the re-engineering, not just to prevent the exposure of the worker to the virus, but to improve cow health and worker health? So can we make all of this better for both workers and cows? Information sharing is, I think, an area that's been really heterogeneous. We talked to some workers who are well informed about H5N1 risks and others that have never heard of it. And it's a year plus in. So that there are dairy workers who've never heard of H5N1 is something that we could address as a real opportunity. And then, of course, can we re-engineer PPE for these agricultural conditions that can help encourage adoption of use, as well as provide really maybe more effective barriers to infection, given that most of the PPE that we have is really not designed for these agricultural environments, and it can get fouled really quickly. And so it may not operate in the same way that you see it operate in, for example, a human healthcare facility. Of course, we really need strong worker engagement strategies, and there have been some resources put into this, and some of my colleagues are working very hard in this space. I think more is always good. This is a very large population, very fragmented, lots of local context, and really maybe different issues depending on each of the subgroups. So these participatory approaches are really critical. And so when I think about this and I think about communication, animal health typically has been focused on ag, not pets, but we have now pets of our ag workers getting infected and dying because of H5N1. So I think that there are some opportunities to bring those together and to think more holistically. And environmental health really has been limited in terms of expertise and scope for infectious diseases. We haven't really thought about the engineering of a dairy barn to prevent much of anything from an infectious disease spread perspective. Most of what we've done there have been other management approaches like vaccination. We also maybe haven't included as explicitly in our communication strategies these less traditional groups, the animal shelter and care organizations, non-commercial entities. Your backyard flocks are as affected as your commercial flocks. It's not that one is infecting the other, they're just both getting exposed from the wild bird reservoir. And then I think we really need to address there are major veterinary care deserts. These are particularly true in rural areas for all animal types, not just livestock and not just companion animals. So some of our emerging challenges are, the rising popularity of raw milk products, the fact that other ruminants can be affected. We know there are quite a few dairy goats in California. I loved going to Laura Chanel's place in Sonoma when I was in vet school a long time ago. We won't say what decade. The cats and the other pet species really have started becoming a real issue. That wild bird interface on the farm is something that needs to be addressed. Understanding the rodent ecology is important. Having better integrated surveillance systems, especially wastewater surveillance with maybe the National Milk Testing Strategy, great area of opportunity. But the place that I think we really need to be putting more emphasis is on our worker and producer mental health and well-being. This is stressful. This is economically stressful. This is stressful in terms of job demands. Imagine that you're a dairy worker last summer when we had the outbreak begin. It's high heat, and now suddenly you have to do a lot more manual labor with the cows, right? If you're going to try to help them out, because they're dehydrated, you're going to need to have a lot more contact with them. So suddenly the work you're doing has changed and increased all quite rapidly. And so it's not like there's a whole cadre of people who can just jump in. You don't really have surge support. You also have the stress of depopulation. That's hard on the producer and it's hard on the workers. And I think it's hard for the workers, especially when we do the stamping out, you'll have one barn really affected, maybe the other barn not so much. And so you're catching some animals that are looking okay. And so it's, I think, a bit unclear, even though we recognize that in a week or 2 weeks, they would not be doing well and that they would go through a lot of suffering from an animal welfare perspective. That's still very difficult for the individual. So all of these really need to be mitigated and addressed. Sort of the closing thought I have here is when you operationalize holistic approaches, think about all the areas that overlap, but think about the areas that don't. I had a student remind me last year, this is where we lack shared responsibility to address the challenges. And so maybe pulling these closer together so that you have more areas of overlap and more areas of shared responsibility, even though you might need to locate leadership within that responsibility, might be another longer term strategy for improvement. So I'm going to stop here because I wanted to leave plenty of time for Q&A, and I appreciate your attention.
Wonderful talk, of course. There's been so much talk recently about H5N1 with so little information that really is useful to us. And the fact that it happens on dairy farms or in poultry farms and out of the purview of most people in the population, it's not really something that is understood and therefore appreciated in terms of its scale and its potential transmission as a pandemic starter. So it's just wonderful that you took such care to walk us through all the pieces, particularly combining the One Health approach with the total worker health approach. The the question about transdisciplinary approaches and interdisciplinary systematic or systems approaches, of course, that's the answer, because there are multiple triggers for this, and therefore they can't be addressed one at a time and sequentially. We'll run out of time and we'll run out of approaches. So it's really great that you brought that up. So we have a couple of questions here, and I want to tell you what they are, and then, take it wherever you want to. You have emphasized the occurrence of this virus in chickens, ducks, cows, sea life, and so on. But one person asks, what is the spread in horse barns? Is it similar because of an open stall concept to dairy with chickens and cats present? Are you anticipating that that's the next place it's going to spread, or are the horse owners safe?
So the good news is that we have not yet identified it in horses. So horses can be involved in some of the influenzas, but so far so good on this one. And we do recognize that California has a major horse industry, and that some of these can be co-located. Although I'll say, just based on my own, because I trained in California and I've been back many times and have done quite a bit of research, the Central Valley has been the most affected. And I think the coast, which is more where you see some of the backyard horses, has been a little bit less affected, but thank goodness nothing yet. I don't know that we're doing active surveillance though.
I was just going to ask you about the fact that there's so much opportunity for transmission, but very little ability to do the surveillance in ways that would detect it in non-specific populations like dairy farms or chicken farms and so on. So what's your recommendation for surveillance? I mean, you did mention all the different pieces that need to come together through the hierarchy of controls. And, surveillance seems to be the entry point for understanding what are we dealing with and with what are we dealing with. I'm sure you've been asked by every newspaper, magazine, and news outlet this question, but how can we improve surveillance?
Yeah, so worker surveillance is, I think, our low-hanging fruit, because we certainly recognize that workers are some of the most exposed. And what I think that we should be doing is getting tests in the hands of workers. Like, I can go buy a test for flu A, flu B, and COVID. And that's great, right? So then I can make decisions based on that test to protect myself, because I've also been given the knowledge for what to do with that test result. So if we do the same thing for workers, only we don't just have it be, hey, you're flu A. That could be seasonal flu. That's a very different control strategy than H5N1. And I know that these tests are in development. So if we can get them in the hands of producers and workers, so the farms know right away when they're positive, that could really help them change their behavior. I worry a lot about take-home exposures, especially now that we've had the reports of the cats that were in the homes of workers that had been exposed, and that there, even though we didn't document any human to human transmission, we know that there was a human household member in one of those households that became ill after. And we know that there are challenges with our PCR based methods for testing, that they don't have as high a sensitivity as we might like. So you can get false negatives. Because of that, we just have a little bit of suspicion that there may be some things happening that we're not catching. And we worry that if the virus changes, that human to human spread is going to be the big problem. And that's a big step on the path to pandemic. We don't want the virus to do that. If you start to hear about more human to human transmission, then that's really your red flag that you need to go from alert for the general public to alarm. Now, public health and workers who are working with the affected industries on infected farms should be at alarm now, right? And consumers can certainly change their practices. But I think that testing is the piece of the surveillance puzzle we don't know. And I know also that there's some really interesting, and there are some COVID tests like this too, right? Where you can scan them. And there is a way for that to go anonymously into a dashboard so that public health authorities recognize where there might be disease that's not getting officially tested. So I think that there would be ways to combine that would help protect worker anonymity and preserve their level of trust with the system, but nonetheless provide a little bit of a, alarm bell for the public health authorities so that they can take some additional measures related to either public messaging, provision of resources, and working with producers to help to limit the spread further.
Yeah, that's helpful. So there's kind of a thought that is bothering me about this area, and that is the case for human to human transmission. Obviously, that is the red flag, as you just pointed out. How do we know that that hasn't happened yet? Because we have a lot of flu going around. We have a lot of people with colds. This is the season where people are getting sick, and it just seems like, everybody around you is sick. There's no mechanism for testing in humans, and it isn't something that when you go to the doctor and you're really sick, that they've got an H5N1 test strip that they can use to test. So what is in the works for being able to detect that? Is there anything commercially produced that would help us identify that should it occur?
Yeah, so actually we have a very clever system for our passive surveillance for influenza. So if you go to urgent care and they do that rapid test and like, oh, you're flu A, here's what we're going to do, right? And they walk you through all of the various options, which could include things like Tamiflu, which is what the workers are getting. It could include other kinds of, supportive care. Every now and then what happens, and so this is something that occurs especially in the larger centers or anything that's part of the FluNet surveillance network, is that those get bundled up, batched, and sent to a laboratory where they're pooled and tested for H5 or H7, right? So these are the zoonotic strains. If they get a positive, they go back to the individual samples and then they can walk it back. So this is what happened with the detection of the Missouri case, you might remember from last year. And the reason that case had already left, and then they had to do all of this trace back through the hospital, right, was because they don't test that often. So it has a major time lag. So the reason I think that we should have more rapid testing is so that we get faster testing. And in fact, I think it was early January, the CDC released a HAN, a health alert, saying we're going to move things through faster. We just need to be testing more for H5 because they were really concerned given the number of human cases that they'd identified on that passive system. Now, those are tip of the iceberg, right? There are places that are not, your home flu test is not going to get pooled, right, and go into the further testing that needs to be done in order to identify H5. The other thing that's been done, and each state, right, has its own kind of mandate, and the CDCs come in to help support this. So how much these activities are ongoing, I'm not sure. But for most of the outbreak, there's been really good traceback. Meaning if there's an infected worker, the in-contact people get tested. If they agree, they get surveyed. There are daily symptom diaries, right? So all of this has been to try to identify the potential for human-to-human transmission. What we know about that one cat case is it could have been on the clothes. It could have been a fomite. Doesn't have to be that the worker necessarily was affected. And we know in both of those cases that were in the MMWR report, the workers declined testing for fear of retaliation at the workplace. So job loss fear. So that is something that comes back to, well, how do we think about the culture of work at the facilities? How can we work with producers to basically make them better managers from the perspective of leadership in culture change in order to help support their workers to be less fearful of retaliation should they come up positive on a test?
Yeah, boy, the whole area of workers on these farms and working for producers in a variety of contexts is really a problem, and several questions have been asked about, what can we do to protect these vulnerable populations, either because they're migrants or undocumented workers and so on. You're saying that we have to think about how to make it a good deal for the producers, for the employers.
Yeah.
And the question really is, does anything exist at this point that you can share?
Yeah. Well, this is a brand new area for the dairy industry. They haven't needed to think about biosecurity and zoonotic diseases in quite this way before. So it's not like we have an off-the-shelf model, right? I think that for the swine and poultry industries, there are other viruses that they struggle with, some of which are just animal health related, others are zoonotic. And so they've had to come back to this a little more often. Some swine facilities do shower in, shower out. So that's, what you might get at a biosecure laboratory that's working on foreign animal diseases, right? So this can be a major investment. And so I noticed that someone had asked about re-engineering the workplace. And so when you're putting that much investment into something, you're not necessarily going to recoup those costs very easily. So if some of these changes are being done for public health, then we may need to think about this more the way we thought about the indemnification programs, where if we're going to come stamp out a flock, we're going to try to compensate the producer for some of those losses. Maybe not make him whole, but at least try to compensate. So can we use that model in this case to help to really catalyze it? Or can we at least roll it in so that when you do need to replace the barn, we have a best practice design that's been tested, right? So we would need to test these. We need to make sure it works for infection control. And we need to do like qualitative work with the workers to find out where their barriers are. How can we redesign to improve both productivity as well as safety and well-being, make it more comfortable for them to work?
Yeah, it's a very important, these things that you're offering as ways to try to combat it at the starting point, at the point of infection. And it just seems like this is such a leaky area where it is creating, with all the animals coming and going out of these places, that you can't really, without, steel traps for everything, that you can't really contain it. What about efforts to prepare for its eventual spread to humans? I know there's I know there's a lot of effort to try to control it at its starting point, but in the minute or so that we have left, is there anything you can tell us in terms of some preparation for down the road problems for us?
There is a candidate vaccine that's been developed. It still needs to go through some additional testing and obviously the emergency use authorization before it could be deployed. I actually was kind of hoping that we would start to see it offered at least to our workers. We recognize uptake may not be great because of that lack of trust, and that what we've been working on most of this past year has been uptake of the seasonal influenza vaccine to help prevent that reassortment potential, right? So that we don't have a worker infected with both seasonal flu and H5 at the same time. But I think that, kind of longer term, really thinking about some of our, other pandemic lessons around communication are just as important. And right now, I think some of the higher risks are within people who consume raw milk, give raw milk to their cats, give raw meat pet food to their pets, because this is also a very different kind of exposure than a workplace exposure. If we were talking about, I have cats, I have some new kittens, and it's a full contact kind of thing, right? The kittens are very close to me all night. And so this is a different exposure than what you might, be able to take your work clothes off and work on the interface at a work site. So home exposures and work exposures are two different things. And we should be thinking about this as holistically as possible, our home life and our work life put together.
Well, that's a beautiful ending. Thank you so much for all of your wisdom, sharing it today. Meghan, I'm very grateful, and thank you so much.
Well, thanks for having me. And it's always great to connect with my sort of academic home state of California.